Hey everybody, it's Dr. Hammerstedt from Holist. I'm here for your Medical Monday. It's just me today. Usually here with Holist, I'm here to talk about awesome things in medicine that our doctors are doing, or interesting topics, or curating food, health and wellness products, services for you, or just giving weight wellness tips. But today I'm going to do something a little different, and I was planning on doing this, but I just had a wicked overnight shift at our trauma center with like 28 patients by myself in 8 hours, and I'm a couple hours late, so maybe I'm feeling a little bit spicier than usual. But I am going to go get into the weeds on the medical and health system right now for you, for patients, for my patients, for your viewers, for my fellow docs. First, let me be positive. I am a physician. I trained at a great medical school and even better emergency medicine residency. I'm 10 years into clinical emergency medicine practice. I'm inspired by teaching trainees here in the US and in East Africa. I'm inspired by my fellow docs who are doing amazing things. And I'm stoked about my Holist business and curating health and wellness products and services and wellness coaching. And I love emergency medicine, and I wouldn't choose to do anything else. I mean, I really get to be there for people when they really, at the moment that they really need me, and see and do interesting things. And I love medicine. I'd go back into it in a heartbeat. But guys, I'm also more than a bit frustrated. Where did we go wrong along the path of our health being between the doctor and her or his patient? It used to be both of our, but not only our responsibilities, right? You as the patient are supposed to eat well, moderate your misbehavior, move your body, work to take care of you and your family and your community, enjoy life, and be a partner to your physician. And I, as the doctor, am supposed to work hard and care about you and blend science and art together and do detective work to make the best decisions and give the best advice that I can in an ever-changing situation and ever-changing world, right? We're supposed to trust each other, that we're each doing our jobs and work together to make the right decisions and choices regarding your health care. But how can we do this when there are just layers and layers of bureaucrats and insurance companies and pharmaceutical companies and hospital systems and legal systems and business industry and in the wellness industry and in the nutrition industry that stand between you as the patient and me as your doctor, waving confusing flags and conflicting data and half-assed literature and snake oil from celebrities and layers of protocols and rules and billing and coding and refusals to pay and ownership and capitalism and politics? I mean, no wonder you're all confused about what and who to believe. No wonder I and my fellow doctors are frustrated by our lack of autonomy and the fact that you don't trust us and the fact that we just can't take care of you without 50 people in the way. And all of those people want a piece of me, and all those people want a piece of you, and they all want to sell us something and to sell us a piece of something. And who can I trust anymore, and who can you trust anymore? So the system's broken. Our doctors are overworked, and we're working in silos, and we don't even know or see each other anymore. We're forgetting why we went into this, and we're searching for a way out, or literally killing ourselves. I mean, literally killing ourselves. There's over 400 docs a year that kill themselves. We're tired of being verbally abused and physically beaten by patients, and you think I'm kidding, but I'm not. Every one of us has stories. Our patients are drug addicted, morbidly obese, completely reliant on medications, and mistrustful of the doctors that are trying to take care of them. I mean, we can't even really see how any of these patients could self-advocate for themselves, much less whether they would either know that they could self-advocate for themselves in a healthy way. So none of the patients accepts to hear just wait it out, or you don't need medicines for this, or see your doctor who knows you, or God forbid, no pain medicines are necessary. So no one wants to take ownership of their bodies and their decisions and their attitudes. So what are we to do? We have all these problems on both sides, the patient side, the doctor side, the business side, the industry side, the hospital side, the insurance side. Here are my suggestions. For us, the doctors, guys, let's sit up, stand up, look around, notice the doctors and nurses and staff around you, smile at them, ask them how they're doing, and if they're happy, and what we can do together to make it better. I mean, shit, if you're faking the smile, who cares, right? It does the same thing. Do it, fake kindness until it becomes kindness, and you can't go wrong. Start advocating for us as a physician profession. Stop worrying about what specialty you're in. Educate your patients on how to access care and when to access care. Educate your neighbors on the healthcare system. Educate your kids' friends on what their bodies do. Educate your media on what doctors do and how much we care. Educate the administrators on the fact that doctors can and do the best that they can for each and every patient, and we do not need 1 million layers. Become an administrator who knows. Educate your legislators on what the medical system is and why the laws they're making make no sense. Spend the time with your patients and help them understand why you're making the decisions you're making. Get out of the rat race and open your own practice where you get to make your own decisions and spend time with patients. Practice self-care, meditate, exercise, eat well, learn about nutrition, take vacations. Stop spending money so you don't have to make more money. If you need to quit or take leave to be sane, do it. If there isn't anything left in your cup, there is nothing for your patients, for your family to drink from. For you, the patient, realize that the doctor is not the enemy. We are stuck in the same vicious cycle as you, in the same system as you. We have spent our entire 20s and some of our 30s learning to take care of you, and to come out of this $500,000 in debt. We're not the ones making money off this. Realize that doctors are people with personalities and flaws and insight and heart and soul, and we're usually right, but we're not always right. So as a patient, take some time to prepare for a medical visit. Write down your symptoms and concerns and practice saying them and explaining what it is that you're feeling. Bring it with you. Call a few places and ask where they think the most appropriate place to seek care is. Your doctor, the urgent care, a specialist, an emergency department. When do you need to be seen? Do some thinking and research, but don't rely on Dr. Google. He should be sued for malpractice most of the time. Be your own advocate, but be kind while you do it. Realize that everyone in the medical system has a clear role, and it may not be what you expect of them. Be clear about what you are concerned about, but realize that the folks who are caring for you have limitations on what they can do. Be prepared to say a few things many times over again. We're not trying to do this to bother you. We are trying not to miss anything. If you disagree with something, tell us, but be kind. Did I say that already? And ask how we may be misunderstanding each other. Realize that you might not feel better right away. Realize that a pill might not fix everything. Realize that waiting isn't a bad thing most of the time. Realize that if shit hits the fan and you're really sick, in my emergency department and those all around the country, we will be there for you. We will be all over you. We will work our asses off to save your life. So realize that. Trust us. Stand up for yourself in your local, state, and national legislature and show up as a patient to public hearings. Call your local medical societies and insurance companies and tell them and make yourself be heard. Write letters to the editors. Thank your nurses and doctors. Tell your neighbors about those that cared for you well. Start asking questions in the news about the news you hear and the bills you get and the laws that are paid and about who is winning and making money off the decisions that are made and the things that are purchased. I can tell you this, it is not the doctors and it is not the patients. So let's stand together, the doctors, the patients, the nurses, the folks that are on the ground together, and let's do this today. Let's do it. Let's fix this problem. So let's go through all this again. Let's approach each other in a different way next time. Hug a doctor today. Hug a patient today. Let's stand up together and get back our medical system for the patients, for the doctors, for the nurses, and for us. And with that, my diatribe is over, and I am going to go home and go to bed. So I'm out. Have a happy Medical Monday, and let's make this world a better place. Take care.